Today's episode is brought to you by Provider Solutions and Development. With a projected shortage of 124,000 physicians by 2034, you need an excellent recruitment partner. Provider Solutions and Development is a leader in physician and APC recruitment because they do recruitment differently, with no commissions and no quotas. With their nationwide provider network, PS&D will work one-on-one with you to create a highly customized recruitment plan designed to find the right candidates for the job. Visit info.psdconnect.org/CareTalk to start the conversation today. That's info.psdconnect.org/CareTalk. Or just click the link in the description. Welcome to CareTalk, America's home for incisive debate about healthcare business and policy. I'm David Williams, president of Health Business Group.
And I'm John Driscoll, the CEO of CareCentrix. David, it is Pride Month, and I think it's really important this month for us to talk about mental health, healthcare issues, and those that affect the LGBTQ community.
John, I would agree. We spent a fair amount of time discussing disparities, social determinants of health broadly, but this is a group we haven't touched on specifically. And I think it actually shows the value of Pride Month, which is to get us discussing these topics. So, John, I want to ask the first question to you. And in fact, we talk about disparities, but what are some disparities in LGBTQ plus health?
Well, there's a bunch. First of all, if you look statistically, LGBTQ community is more likely to suffer from preventable and manageable traditional healthcare issues like cancer, heart disease, breast and cervical cancers, as well as being at higher risk of smoking abuse and alcohol abuse. And in general, it is a group that has, not surprisingly, given the stigma that has historically been associated with this population, a lot of mental health issues. I mean, there was one study where 1 out of every 10 LGBTQ folks admitted that a doctor had refused to see them because of their actual or perceived sexual orientation. The number drifts up to 3 or 4 in 10 if you're asking trans people whether they've been refused access to treatment. I mean, those are horrifying statistics that are basically dislocating this vulnerable population from access to care. I can't imagine, particularly a group that's already suffering, that they have to deal with these kinds of barriers to care.
John, I want to emphasize what you brought up at first about when you ask about, what are some of the specific issues, and you went right to heart disease, cancer, things like that, which are kind of physical disorders. And a lot of that ties in directly from, as a direct consequence of alcohol abuse and misuse, which is again driven by probably some of the the pressures that people are feeling, the sort of the stress of being in a minority group, and that many people broadly have had during the pandemic. And this should actually lead us to the realization that these sort of issues of stress then leading to substance abuse and then leading to physical conditions. There are some other things that as where I thought you were going to start that are kind of make sense when you think about them. So, lack of recognition of healthcare needs. So, for example, if a trans or non-binary person is going to a gynecologist, they may struggle with, what kind of care is actually needed. You also see eating disorders, which have to do with low self-esteem, unrealistic body standards. Something like 50% of people in the community actually suffer from an eating disorder of one kind or another. And then there's some other things that are stigma. For example, intimate partner violence, especially among men. There's a stigma about getting help, even though the prevalence of abuse is similar to that in heterosexual relationships. So quite a lot to unpack there, John.
But I think a lot of this comes back. I think we got to chunk it into different challenges. One is for any minority community around which there has been a fair amount of stigma, criticism, dislocation, there's going to be mental health issues are going to follow. And I think that's the importance, to your point, of why we've got to recognize Pride Month and call out some of the differences that exist about access and patterns of care. Most medical schools, David, still don't teach much about this population. And as a vulnerable population that affects millions of people in the US, to not even teach about it when we know that there are, to your point, that this population is suffering more than other populations, it just seems crazy. And I think it makes it harder for docs to then orient, accept, and engage this population, which is probably, and at worst, denying access to care for vulnerable patients. And again, it's important to call this out as a structural problem, not just a problem of kind of behavior and social challenges within the population. You've got a lot of prejudice and stigma, and you've really got some significant access of care issues.
So, John, they call it Pride Month, not like Woe is Me Month. So let's talk about some of the positive things that can be done. And in particular, how the LGBTQ plus population can improve healthcare. Now, you're talking about, for example, medical school training. So let's take that on the other side. And there are groups that are advocating for, let's actually train medical students in how to work with this population, among others. Some of the things that you see on a policy level, like anti-bullying policies, a lot of those are actually helpful for the LGBTQ plus community in particular. There's also things that people do from a kind of a self-advocacy standpoint, like finding the right physician who actually, will not just be willing to see you, but actually knows how to work with people that have your same situations, the same as you would for any kind of experience. And part of that, and some people do this during Pride Month, is coming out to their physicians and specifically talking about what they can do and taking practical steps, whether that might be PrEP in the case of HIV prevention, other STD testing, and other practical things that they might do to take control of their own health.
Yeah, I think the most important thing in Pride Month is to recognize that that LGBTQ minorities are part of the broader community, and that we need to treat all patients as having unique needs. In the same way we've called out discrimination and lack of access to care for racial minorities, we've got to do the same for folks who are minorities by dint of sexual orientation. There's a lot we can do here, David, if we're aware of it. Again, it starts with making sure there's access. Typically, in this community, you also have a number of folks who don't have as much health. There's not as much healthcare coverage of insurance as there should be. I mean, this is a minority population that is really suffering, and I think as a healthcare system that's oriented towards healing, we need to make sure that the on-ramps and access to care are there, and then that the medical talent is there to support them. And I think the other thing I'd underscore is, like any challenge, and you're seeing this in the anxiety and depression statistics, which are much higher for children and adults who have who are LGBTQ or identify as LGBTQ. We don't have a very accessible mental health care system in America in general. Then you add to that some folks will refuse to treat or not know how to treat folks from this community. I think that probably there's a simmering crisis of care at the edges in this community that we're not really taking seriously, because it was even hard to get great statistics on where the problems were and how we can solve them. And we love our statistics, but particularly when you've got a minority community, it gets really hard.
John, I mean, you and I have both been around long enough that we can look at the broad sweep of history, at least over the past half century or so. And I want to put out the question of, how much progress has there been? On the one hand, since around 1969, there's definitely been an awareness of first sort of gay liberation, and then, broadening it and talking about, as we do now, LGBTQ plus. And there have been things just in the recent years about legalizing same-sex marriage at the national level that happened very fast. And at the same time, you see some people using this as a wedge issue, as you've seen in Florida and other places, in Virginia and other places. And I wonder, are you seeing progress? Not seeing progress? What do we learn from this?
Asked generally, of course, there's been progress. I mean, the LGBTQ community, we've actually got same-sex marriage as a right. We've made enormous progress against AIDS through all of the pharmaceutical interventions and have made those drugs available and accessible domestically through the conventional expensive means that they're distributed in the U.S. and abroad through all the good work of PEPFAR and those are sort of unimaginable in the moment. The AIDS crisis at the time in the 70s and the 80s really was a disaster, and drugs were inaccessible. And through the good work of tough-minded advocacy organizations like ACT UP and others, coverage was provided and the drugs were delivered. And then you've seen an incredibly sophisticated political movement to put fairness around the right to marry who you love on the ballot and in people's minds as something that's acceptable. Having said that, I don't think we can forget all of the genuine challenges that folks in a minority community have, particularly one for whom there's enough prejudice and lack of understanding of us being one basic human community that some inane politicians can use the issue of sexual preference or transgender issues as somehow a wedge issue to disorient people and distract them from the economic issues that I think feeds a level of prejudice and stigma that probably feeds that cycle of mental anxiety that we're seeing much more prevalent among the LGBTQ plus community than not.
John, let's end on the topic of older people in the LGBTQ plus community and new issues that may be coming up for them. As we know, a lot of healthcare is delivered toward the end of life. And so it's not just about a person going to the gynecologist for the first time. We're also talking about dealing with geriatricians, dealing with senior housing loss, and just sort of the loss of autonomy that older people sometimes experience as they go into assisted living or nursing homes. Now you're talking about people that may be in their 70s, 80s, even older, who maybe were not out and maybe never were, and now we're going into different type of housing and facing challenges there. So I just want to raise that topic, see if you have any.
Yeah, no, I think with 10,000 people turning Medicare eligible every day, you're going to have a substantial minority that are going to be LGBTQ plus, regardless of whether they ever identified that way. And you're probably dealing with an older demographic of doctors, nurses, and care supporters who wouldn't necessarily have been exposed as much to that community and maybe a little bit more conservative or just concerned. And I think that's why Pride Month is so powerful. The more we can identify the minority members of our community from whatever minority who previously been stigmatized as members of our community, the more likely we are to actually heal, build bridges and heal those gaps and bring people the knowledge and the insight that that there are some folks who are suffering and that we need to embrace them. I guess on a happy note, David, this is Pride Month, and hopefully the powerful message of that we should be proud of all of members of our community will help kind of build those bridges that we need to see built to the older caregivers, so that our members of our aging population from that community get the care they need.
Well, John, let's leave it right there. This is David Williams, President of Health Business Group.
And I'm John Driscoll, the CEO of CareCentrix. If you liked what you heard or you didn't, please subscribe on your favorite service.